Hello my dear friends, this is Nagpur Health channel. Most welcome you. The vision of Nagpur Health channel is providing health information to the society for the betterment of mankind. The mission of Nagpur Health channel is making society aware to the health and giving the information to the society the first home treatment in case of health emergency, to give the information about the treatment of the disease with the help of a specialist. Today with us Dr. Sandip Dhoot sir. Most welcome sir.
Nice.
He is MBBS, MD Medicine, DNB Cardiology. He has 15 years vast experience. Currently, he is cardiac consultant at New Era Hospital and Research Center, CA Road, Nagpur. Sir, most welcome to our channel.
Thank you, doctor.
Today's our topic is atrial fibrillation. Do you know we are all at the risk of atrial fibrillation? Doctor, my first question is, what is atrial fibrillation?
See, atrial fibrillation is one kind of arrhythmia where your heartbeats goes irregular and fast. Normally, we have a heart rate less than 100 and it's a regular one, but there your heartbeat goes irregular and fast. Like we are having normal heartbeat like tuck, 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 tuck. In atrial fibrillation, it goes fast and irregular. Tuck, 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 tuck. So what happens? Normally we are not aware of our own heartbeat, but in atrial fibrillation we become aware of our own heartbeat. So this is fast and irregular kind of arrhythmia is atrial fibrillation.
What is the symptom of this AF?
See, the symptom one which I already told you that normally we are not aware of our own heartbeat, but in atrial fibrillation you become aware of your own heartbeat. You start feeling uneasy, palpitations. Then atrial fibrillation is most of the time diagnosed when it causes some complications. Okay, like heart attack or some stroke. Then many a times it is diagnosed in the hospital when the ECG is done. We see that the patient is having AF.
So, what are the causes of this AF?
Atrial fibrillation is that arrhythmia where means suppose we are having hypertension. Hypertension is one of the major risk factor for AF. Then if we are having thyroid disease, hyperthyroidism is one of the very important cause of atrial fibrillation. Then this pre-existing heart diseases, if we are having valvular heart disease, rheumatic heart disease or some kind of valvular heart disease, then we are at increased risk of atrial fibrillation. But the most important risk factor is age. Means as we grow old, like our knees gets damaged in older age, like that our heart also gets the conduction system gets weak, and we are at increased risk of atrial fibrillation as we grow old. When we are in our 70s, 80s, then we are at increased risk of atrial fibrillation.
So, how this atrial fibrillation is diagnosed?
First, you should be aware that means you should identify that you are having some uneasiness, you are having palpitations, you are having some irregular heartbeats. Then what you can do, you can touch here. Okay, you can see that you are having pulse here. It becomes irregular and fast. Okay, so first is that indication. If you have, some people have Apple watches nowadays, Apple watches or some wearable gadgets have some algorithms. So even low cost devices are also available which have some algorithms which can identify atrial fibrillation at an early stage. Okay, then you can if you see that you are in substrate, then you can go to the hospital and they can also diagnose it. In pulse we can, means many people have pulse ox nowadays at home. Pulse ox, that's sphygmomanometer in which you measure oxygen saturation. Nowadays during this corona pandemic, every other house or home has this pulse ox machine at with you, this one. Okay, this machine with you, you can apply it in your finger and see whether your heartbeat is fast and irregular, and then you can visit the nearest medical facility and get an ECG done. Final diagnosis of atrial fibrillation is by ECG.
Sir, how with the help of this instrument we can check the AF?
You can see that if we apply this.
Okay. There is the mode of AF.
Okay. No, there is not any mode of AF. There normally what happens is we get our pulse rate and saturation there.
Okay.
So in the pulse here you can see that my pulse rate is 88. Okay. So this pulse goes higher and there are variable numbers. Means one time you will see 150, other time you will see 110, and again means you will see 130 like that. It will be more than 100 but varying number. That shows that there is irregularity in it.
Okay. Sir, how AF is treated?
See, what means rather than treating AF, means we should treat AF, but we have to prevent the havoc it can cause. Excuse me, Dr. Me. So, what havocs it can cause? It can increase the risk of heart attack by 2 times. It can increase the risk of stroke by 5 times, and there is increased tendency of clot formation in AF. What happens? In normally we have means single SA node is boss, and the heart contracts in a synchronization. Means our heart contracts like this: atria, then ventricle, atria, then ventricle, atria, then ventricle. What happens, and that too in synchronized manner? Cardiac muscle contracts in synchronized manner. What happens in atrial fibrillation? This synchronization is lost. There, this atria contracts like this. Okay, so when it contracts like this, there is stagnancy of blood, and this increases. Whenever there is stagnancy, there is increased risk of clot formation. These clots can go anywhere in body and can damage your body, can disable you. They can cause heart attacks, they can cause stroke, they can go to your kidneys and block the vessels, and the kidneys can get damaged. They can go to your lower limbs or upper limbs, and you may get paralyzed, or that limb may get gangrene. Okay, so whenever you go to doctors, okay, they will diagnose it atrial fibrillation, and they will give you medications which decrease your heart rate. They will treat your primary means disabilities, like if you are having hypertension or heart disease or some thyroid problem, they will treat it. And most important one is they will calculate Charts score and Hasdard score, and will prescribe you anticoagulants if you fit in those criteria. So this decreases the tendency of clot formation and can prevent the disabilities or havocs which atrial fibrillation can cause.
Means AF is very dangerous to our life.
Yes, sure. AF is very dangerous. It rather than means killing you, it disables you. Okay, so disability is very means it can cause you a stroke and anything, and it can disable you. So it is even more dangerous than death, I will guess. I dare to say. Sorry.
Sir, your message to the society.
My message is very clear. If we should identify that whether we are at risk factor of atrial fibrillation, if we are having hypertension, if we are having this thyroid disease, if we are having some heart disease, valvular heart problems, and if we start feeling uneasy or we start feeling palpitations, then we should detect the AF early and should get it treated fast, because that can damage you. So my message is clear, loud and clear, that prevention is better than cure. Okay, so prevention of major complications is better than to be disabled for life.
Thank you so much, sir. Thank you for giving your valuable time to us. Thank you so much.
Thank you, Dr. Amit.
Thank you to all. If you want to be part of this Nagpur Health channel, please write to us at nagpurhealth@gmail.com. Thank you so much.